I'm Dennis Anderson along with Pamela Fish, and here's what's coming up on Almanac North.
Minnesota's new online insurance marketplace, MNSure, went live this week, the first test of the nation's new Affordable Care Act. Our guests have opposing viewpoints on the law.
The partial federal government shutdown is having an unwanted effect in our region. Our guests in that segment have experienced that impact firsthand.
And we'll have the latest business news and a news file story from 25 years ago.
It's all coming up next on Almanac North. Hello and welcome to Almanac North, and thank you very much for watching. Pamela Fish is here this week, filling in for Julie. Pam, welcome back. Nice to have you.
Well, thanks for having me here, Denny. Appreciate it.
You bet. Well, we've got the topics that everyone is talking about this week, so let's get started.
All right, thank you. Well, Tuesday was a big day for the Patient Protection and Affordable Care Act, more commonly known as Obamacare. October 1st marked the debut of the online health insurance marketplace, where individuals and businesses can find competitive health insurance plans. The new law requires all Americans to have health insurance by January 1st or pay a fine. So far, early reviews are mixed, but millions of Americans have logged in to check out the exchange. Joining us now with more is Representative Tom Huntley of Duluth, one of the architects of Minnesota's plan. And Mike Hickey is the Minnesota Director of the National Federation of Independent Businesses, which opposed the Affordable Care Act. And welcome to you both. Thanks for being here.
Pleasure to be here.
Well, Representative Huntley, I want to start with you to find out if there's been any reaction with how MNSure is going this week.
There's differences around the state. Some places it seems to be going better. I know the MNSure phone place has already registered 4,000 people that have called in and filled out the things, and they still have to have their background checks sort of done. But so it's off and running, and it started a few hours late.
Yeah.
But we didn't have the problems that they've had in many other states.
Mike, what's your biggest problem about Obamacare?
The employer mandate, Dennis, is the biggest one. Now, that's been suspended for a year, and a lot of people feel the president doesn't even have the authority to do it, and I wish somebody would file a lawsuit about that. But also, there's going to be big increases for small employers due to the community rating provision, about 6 to 7% new permanent taxes. They're going to fall only on small employers and individuals, and these are all the things people don't quite realize. And worse yet, a new reinsurance tax we're all paying. This falls on both large and small companies. We're all paying a 1.1% reinsurance tax to help multi-million-dollar insurance companies work out their reinsurance. Doesn't that make you feel good?
Well, let's back up a little bit, though, to the fact that it is law, and Representative Huntley, you had something to do with putting together the Minnesota provisions for that. Tell us just, what is MNSure?
MNSure is a place you can call, or a place that you can get on their website, and you can look at all the options for plans that are being sold in the exchange. And the exchange is for people that 70% of the people get their insurance through their employer, and that's right. They're still going to get. That's not going to change. But if you don't get it through your employer, or if you're self-employed, then this is a place. And if you're below 400% of poverty, then you can go into the exchange and get a plan and get subsidized, so that you don't have to pay the full cost of it.
Now, you mentioned that that people are insured under their employer, but does everybody have to check in online with MNSure? Does everybody have to be part of this?
No, only those that want to buy insurance through the exchange.
We have a lot of retirees living in this area, northern Minnesota, northern Wisconsin. Are retirees going to see an increase in insurance costs and premium costs for their supplemental insurance?
If they're on Medicare, they're not affected at all.
Not at all.
So it's up to age 65, and it does not affect those who are eligible for Medicare.
Dennis, an important point to echo what Tom said is that unless you want subsidized coverage in this exchange, and really you're going to have to, for an individual, that'd be more than $45,960 annual income and a family of four, $94,200. If you're under that and you want to try to see if you're eligible for subsidized coverage or take a look at that, those are the only people who really need to go to the exchange. And a lot of them are going to be young people and people who don't have coverage right now. The vast majority of people are not going to be impacted that much.
Gentlemen, the deadline
it's a lot
is-
of the other changes in the insurance that are raising premiums and restricting options for people that we're really concerned about.
The deadline to sign up is still January 1st.
Actually, I think it's December 15th.
December 15th now?
If you want to start on January 1st.
I see. Okay, thank you for the clarification.
It takes
Then a fine will take effect if you do not buy. Is that correct?
There is a federal income tax penalty if you do not have health insurance.
How much will that be? Any idea?
1% of income or $95, whichever is higher, although we had a very good meeting with an insurance agent and some of our members earlier this week, and the agent speculated that they're only going to really get you if you have a refund. The IRS cannot go after a citizen on this like they could on tax evasion. So I think it's people with the refund, they're going to get
They would
that,
subtract it out of the refund.
that chipped away. Other people, they may be able to skate on it. We'll have to see how it all works out.
Mike, some of the other key points for businesses, for small businesses, if you have under a certain number of employees or over a certain number of employees, tell us about how that works.
Well, the employer mandate's the most problematic thing, and we think we know it's causing a lot of bigger companies to make people part-time, and I think that's happening with some small businesses too, but it's really been documented with some of the larger companies. They're not giving people more than 30 hours, and three major labor leaders, including James Hoffa Jr., sent a letter to President Obama and former Speaker Nancy Pelosi and to Senator Harry Reid saying you got to revise this law significantly. You're destroying the 40-hour work week. So we've got the employer mandate out there, which I think is going to be a real drag on the economy. And we have three major labor leaders saying this is a real problem. But also the underwriting change. 75% of the small businesses, the new rates have been filed. 75% of the small businesses are getting an increase based on the analysis of the new rates. This is not an actuarial analysis. These are the new rates, and up to 40% increase. And so that's really bad news for those people. They're jamming full community rating down our throat. We had a modified community rating in Minnesota that worked well since 1992, but this is a one-size-fits-all, jam it down our throat. Minnesota doesn't need most of this law, but also, as I mentioned, about 7.5% in new taxes on people, on individuals and small business, and not on Fortune 500 companies, and that's incredibly unfair.
But it begs the question, Tom.
We have a long list of grievances.
Are there regional differences in plans and costs?
Within the state, yes.
Within the state of Minnesota?
Yeah, right. Overall, if you take the average in Minnesota, it's the cheapest in the country. So we have done a much better job, and I think part of that's because we did our own exchange rather than having the federal government do it. And in addition to that, we have pretty good health plans in Minnesota that we negotiated, or not we, but the MNSure negotiated with them, the Department of Commerce negotiated with them, and they came in with the lowest prices in the country.
So just because of the population down in the Twin Cities, there may be more plans available.
It's hard. Every county has at least two plans. The trouble is there may be parts of a county that don't. And Rochester is the big problem. There's only one plan in the individual
county
marketplace in the city of Rochester.
Our individual rates came in really low, and part of that's due to that reinsurance tax we're all having to pay. And some of these plans, we've gone back to closed networks, which people didn't like, and we sort of rejected that. Back in the 80s and 90s, but in a lot of these plans, you can't go to Mayo Clinic, you can't go to Abbott Northwestern's Heart Unit, and so people are going to have to really look at the fine print in this.
Representative
Well, I
Huntley,
would,
do
I
you
would
wanna
say
answer
though
to
that we already have those kinds of rules, and I have state health insurance, or when I was at the university, I also had university insurance. And in both cases, I couldn't go to every doctor I wanted. I had to choose a clinic and stick with that, and I happened to choose one that cost me a little bit more because they charge a little bit more.
So Mike's talking about a number of things that he says makes this a bad deal. Tell us what you think the benefits are and why you work so hard on this.
Well, you know, we're the only industrialized country in the world that hasn't figured out how to give or provide health insurance to every one of its citizens. We're the only one that hasn't done that. Every other country is spending the rest of them are spending about half of the industrialized countries, about half the amount of money we spend on health care as we do in this country. People like former Secretary of the Treasury under George Bush, who had been the president of Alcoa, says that 40% of what we spend in healthcare is wasted in this country. It doesn't do anybody any good.
Taxpayers already pay for people who don't have insurance?
Every person that has health insurance, if you have a family health insurance plan, probably $15,000-16,000. 1,000 of that is to cover uncompensated care that hospitals have, because when people show up at the hospital, they don't have insurance. The hospital has to treat them and will treat them to keep them alive. So what are the hospitals going to do? They raise the rates to everybody else.
So another question.
We're already paying for those people.
Another question a lot of viewers might have, will medical costs go down, or will they continue to increase under this plan?
They're going to increase. There's nothing in this law to reduce costs. It's the greatest failing of this law.
There
Aside from
are
everything I've
lots of
mentioned.
things in this law. For instance, paying providers that deliver good care cheaply. There are many things in this, and actually we started in Minnesota, which is a medical homes where you pay people to keep people healthy instead of paying them a lot when they get really sick. And there is starting to be significant changes in that. I can tell you, as an example, SMDC and St. Luke's had a congestive heart failure program where they saved 48% of the money on these people, kept them out of the hospital. Trouble is, they couldn't get paid for what they did. And the new payment systems that are part of the Affordable Care Act will pay them for doing the right thing.
So you're talking also about preventive care and such that is going to lower costs. I think that's what you're alluding to. But how long will it be before we see decreased costs of medical care?
You're not going to see it.
I would say you're going to see it. You're going to see a bend in the curve. You know, the curve's been going up at roughly 3 times the rate of inflation for the last couple of years. It hasn't gone up that fast because the insurance companies are pretty nervous about this law.
Mike, why do you feel we're not going to see it?
There's really nothing in this law to reduce cost. This is an access law. It's going to help out people who qualify for the subsidies. There's a price for the economy with 12 to 13 new taxes, but I mean, certainly people are going to be helped who get subsidized coverage who didn't have it. There's nothing in here to control cost. It's the greatest failing of this law. There's also a great concern that a lot of small medical clinics are going to go out of business due to the administrative burden of this law, and that's going to be sad to see everything get more integrated if that occurs.
In
and
your
to see
opinion,
the smaller town doctor kind of disappear, and that's going to be sad if that occurs.
should the law have been reworked, revised, or should the government not be involved?
Dennis, you know what this bill needed? This bill needed about 6 months in conference committee, and Tom's been on a lot of them, and he can tell you about the dynamics of conference committees. But what happened, if you might recall, is Scott Brown won that special election in Massachusetts, and they jammed this through on Christmas Eve in the Senate using the Budget Reconciliation Act for something that is about 80% not budget. And then the House took it up. They couldn't change one thing. A lot of the Democrat House members are upset about that. This bill needed like 6 months in conference committee with people like Tom Huntley at the federal level changing it, striking things, revising things, having people who are smart in insurance and health clinics coming in and telling them all the things that are flawed with the law. Instead, we have a very bad law that was jammed through.
Obviously, there are efforts underway to make changes. Representative Huntley, what if there is some kind of an overhaul? Are you concerned about that?
There are, unlike what Mike said, there are many things in this bill that did not get a lot of attention that are directed at controlling costs and improving healthcare delivery system. There are many changes, as we talked about the medical homes, where you have a group of providers, which could be a doctor, a nurse practitioner, in some cases a social worker, integrating the care that this patient gets. There are plenty of things in this bill that will reward groups that do that. There are plenty of things in this bill that will reward groups of providers that save their patients money by keeping them healthy, and that will reduce the costs dramatically.
Right. Well, the debate will go on, and we shall see what happens with this, but we appreciate your insights and the information that you provided. We do want to let people know there are a couple important websites that they should look for to find out more. One is www.healthcare.gov, and the other one for MNSure, that's MNSure.org. But again, thank you, gentlemen, for being here.
You.
All
Thank
right.
you both very
Appreciate
much.
it. Thanks
Appreciate
much.
it very kindly. Thank you.
Now, let's dig into our news file archive for a look at what was making news 25 years ago this week.
Geologists have always been convinced that there's something more than taconite to be mined in Minnesota, but that theory hadn't been tested until recently. 2 years ago, scientists from the Natural Resources Research Institute began studying core samples from several sites in northern Minnesota. Today, they announced that they found gold, silver, platinum, and palladium in some samples taken 10 miles southeast of Ely. The samples were taken by the M.A. Hanna Company in an area known to contain deposits of copper and nickel. The best samples are valued at close to $100 a ton.
Most of the contained value in this prospect is the copper and nickel. It accounts for 75 to 85% of those numbers up there. The precious metals in this case is just what the project set out to do. It is added on value to that particular area.
M.A. Hanna doesn't have a lease on the land, so any company could begin mineral exploration there. Carla Powers, KDLH News.
The fight over the national health care law has created an impasse in Washington, forcing a partial shutdown of the government. Republican demands for changes in Obamacare resulted in a stalemate over the budget. Hundreds of thousands of federal government employees and contractors are experiencing unpaid furloughs. Among those sent home without pay, nearly 150 workers at Duluth's EPA lab. Our guests tonight have more on the impact of the federal shutdown. Elaine Hansen is director of UMD's Center for Economic Development, which works closely with the Small Business Administration. And Maria Princen is an Americorp Vista member who will not be paid her living allowance while this impasse continues. And thanks to both of you for being here. And Elaine, for many, it's business as usual, but that's not the case with many folks you work with.
Well, with many of the businesses that we work with that are looking for loans, they're working with their banks and trying to get SBA insured loans. And with the beginning of the new year being October 1st, loans were not processed after, they were supposed to be processed till 11:30 on September 30th, but the appropriation for the prior year ran out at 9:30. So anyone that's looking for loan and working on the loan guarantees are stymied right now.
Is this normally a busy time for the EPA?
For the EPA?
For the
SBA.
I'm sorry.
SBA.
For the SBA?
This is a very busy
Yeah.
time for the SBA because it's the end of one year and the beginning of the next year. We had a veterans conference on Monday, which was the 30th, and we had scheduled it that day because it was the last day of their
okay.
fiscal year. And they didn't know what their funding would be like for the coming year, and that was for veterans that are in business or wanted to start businesses. So.
Maria, it's a different situation with you. Now, you work for a nonprofit through Americorp,
Correct.
which is a federal program. So that's been cut, but you're still at work, I understand.
Right, that's right. And I can only speak for my own program, which is the Vista Americorp program.
Okay.
And that's specifically geared towards eliminating poverty, although we're placed in various nonprofits throughout the country to build capacity, so we don't have direct service. So our funding differs from a number of other Americorp programs.
Okay.
The Vista program is actually not tied into any state funding. So that's right, I will be, the funds that are appropriated for paying us are frozen until the government opens up again, and I'm hoping for back pay, but
Yeah.
we don't know it.
What have you been told?
So our stipulations right now are that we still have to go to work 40 hours. We don't get the pay, and we cannot take a second job. These are all written into our contract.
If this is prolonged, do you see the work continuing, or will there be a point when you may stop?
Right, well, that is definitely a question a lot of us are facing, and myself personally, the work that I'm doing is integral to a lot of needs in this community, and we have the option to exit early and still get an education stipend at the end, and that's sort of a bonus to our
Sure.
11,000 yearly salary of sorts. But I could not tell you how I could make that decision yet. Yeah.
Elaine, tell us a little bit more about the people that are being impacted. Are these local people who have small businesses who want to get into a small business?
Well, there are a number of different ways that there is an impact, and the largest impact is on the loans. People that are trying to expand their business, refinance, buy new machinery, buy equipment. There's several different SBA loan programs, and all of them have stopped at this point in time. And then in some areas of the country, we are a small business development center in northeastern Minnesota. Our grant goes through December 31st. However, in other places in the country, they are on the federal year.
Sure.
So their small business development centers have stopped. We work very, very closely with the SBA in Minnesota, and I have frequent conversations with the people on other programs.
Yeah.
They're not working.
Are there a number of people
They're gone.
locally whose loans have not been processed then?
Oh, I know. I'm sure that there are many.
Many.
That have not been
Yeah.
processed, or they're on hold.
Or they're on hold?
And if you're trying to buy equipment and your loan is on hold, that makes it a little bit difficult. Or if you're trying to do a building project and you can't start, or you can't pay the contractor, or you have different, you're trying to refinance. It's difficult.
If you could talk to a lawmaker right now that is either a U.S. senator or representative, what would you say to him or her?
Please be reasonable, and let's make some compromise.
Same with you?
Yes,
Yeah.
and I should not get very partisan, but this affects real people in everyday scenarios, and myself included, but a lot of lower income people in the community as well, and this really does go beyond just petty issues.
What exactly is Americorp Vista?
Americorp Vista builds capacity within nonprofit organizations throughout the nation, although my specific cohort is assisting ex-offenders in reentry.
Could schools be affected too? Are people who
Right.
work in schools?
Yes,
Yeah.
absolutely. Although there are a number of Americorp members up here through the YMCA, and their funding is through the state, so they are still in business. There are also Americorp members through LISC, and they are also being funded. LISC has some set aside funds
Sure.
for these sorts of emergencies, so they are also unaffected by
Yeah.
this.
Well, we don't know when this will end, so I guess everybody
we wish
just
you luck with
holds
your
on.
individual
Yeah.
situations.
All right. Thank you both for being here tonight.
Thank you.
Thank
Thanks
you.
a lot. It's time for a look at the week's top business stories from Business North. The success of AAR Corporation at its Duluth aircraft maintenance base is creating challenges for the company. With 40 current openings, AAR needs to attract qualified employees and also find a place for them to live. Lake Superior College is working as quickly as possible to address the first issue by launching an aircraft maintenance program, hopefully by next fall. The new curriculum must be approved by the Federal Aviation Administration before it can be offered. As far as housing is concerned, at a Thursday news conference, Mayor Don Ness said the rental vacancy rate is less than 1%, and he called for construction of quality, affordable housing.
Northern States Power Company is challenging the cleanup proposed by the Environmental Protection Agency for Ashland's $71 million Superfund site. The utility is at odds with the EPA over the agency's plan to dry dredge contaminated sediments near Ashland's shoreline. NSP believes dry dredging may pose safety risks to workers who clean the site. The EPA says wet dredging may not meet its environmental standards. The utility and the EPA agreed to do more sampling at the site to further examine all of the issues.
Visit Duluth President and CEO Terry Matson will leave Visit Duluth in December after completion of the National Snow Cross at Spirit Mountain. The 51-year-old Matson said now's the right time to leave the tourism group, where he has held the top post for 28 years. Saying it's important to stop and smell the roses, Matson plans to spend more time at his family farm in northern Wisconsin, riding his motorcycle on the open road and snowmobiling along wooden trails. For more on these and other stories, visit businessnorth.com.
If you have a comment on tonight's show, and we're sure to get some this week, now's the time to call. Dial 218-788-2849 to leave a message or send an email to Almanac North at WDSE.org. And you can visit the WDSE website for the latest news and information about the station, including special events, public meeting notices, and links to PBS programming. Well, Pam, it was great to have you back on the program this week. You can come back anytime.
Well, thank you very much. I'd be happy to, Danny.
All right, thank you. For Pamela and the crew here at Almanac North, I'm Dennis Anderson. Have a great weekend, everybody, and be kind.